The meds we are going to go over today are cephalosporins, SNRIs, muscle relaxers, and ACE inhibitors. SNRIs, such as duloxetine, venlafaxine, desvenlafaxine, used for fibromyalgia, MDD, GAD, neuropathic pain, and social anxiety. It's going to enhance mood regulation and pain. You might see insomnia, blurred vision, erectile dysfunction, GI upset, serotonin syndrome, suicidal thoughts. So I think of SNRI. S as in serotonin syndrome / suicidal thoughts. N as in never stop taking the medication abruptly. R as in regulates mood. I as in insomnia, which should make you think to ask about their sleep patterns. Muscle relaxers, such as cyclobenzaprine, known as Flexeril, or Baclofen. Think of BAC, B for back pain or Baclofen. A, you can think of avoid alcohol, or it might cause abdominal discomfort. C for cyclobenzaprine, it's used for MS, acute back pain, or neck spasm. It prevents the release of calcium in the muscles. Think of relax. R as in rapid heart rate, elevated bilirubin, which would cause you to be jaundiced, low blood pressure, which then you might become dizzy or hypotensive, A as in abdominal discomfort, and X as in extra muscle weakness. Side effects are too much of a good thing. We're trying to relax our muscles, but if we relax them too much, we're going to have extra muscle weakness. You can also remember Flexeril as in flex, flexing my muscles. ACE inhibitors, most common one being lisinopril. They end in pril. I want you to think of two people, ACE and April. It's used for hypertension, heart failure, heart attacks, diabetic and non-diabetic neuropathy, because it's going to help lower the blood pressure. So it's going to improve cardiac output. It's going to lower that peripheral resistance. So I might see hypotension, angioedema, dry cough, which is most common, dizziness, and itchy skin, just to name a few. I want to watch their blood pressure because we're talking about blood pressure here. I want to watch their potassium levels because when there is nothing coming out of that blood vessel, you're going to have too much potassium in the blood. When we have too much potassium in the blood, of course, I'm going to be swollen. Think of angioedema, cough, have way too much fluid coming in. It's going to cause me to cough. E as in elevated potassium. A, I might have altered taste. E as in potassium, going back to watching levels. R as in rise slowly, because if we get up too fast, it might cause me to become dizzy or hypotensive. I as it improves cardiac output. And L as in lowers blood pressure. Cephalosporin, cefalozolin, or Keflex, also known as cephalexin. It's used for UTIs, otitis media, so ear infections, bone infections, respiratory infections, and surgical prophylaxis, because I don't want to get infection after I had surgery. I might see a rash, nausea, vomiting, diarrhea, Stevens-Johnson syndrome, anaphylaxis, C. diff, and oral thrush. I'm going to think of CEF as in ceph, and you can think of also S as in the second part of it, so cephalosporins. It could cause C, and use a second barrier of contraception. E as in entire course completed. With any antibiotic, you should finish the entire course. F as in fights infection, and S as in Stevens-Johnson syndrome. You want to report that right away. Hope this one helped. If you guys have any specific medications you want me to try this on, let me know. Otherwise, I will see you guys in the next one.